Hello, in this video we'll be discussing the Philippine Health Insurance Corporation, PHIC, more commonly known as PhilHealth. So for this topic we will be having two videos. Again, the first one will be about the organization, the GOCC, the agency. So we'll be visiting their website, we'll be discussing the law, the IRR, and then the amendments, as well as the benefits that can be availed by the members. And then we will be first discuss the contribution. And then the second video would be about the financial statements of PhilHealth, their annual report, and then the latest quarterly financial report that they provided, as of September 2020. Okay, so to begin this video, let's have the contribution. In recent years, they have decided to implement a staggered sort of scheduled increases in the premium to be paid by the members of PhilHealth. So last year, 2020, the rate is at 3%. So 3% of your basic salary, and this is to be shared by the employee and the employer equally. Okay, unless you're self-employed, then you have to shoulder the whole 3% by yourself. Okay, and then of course they have the minimum and the maximum amounts of premium. Minimum is 300 pesos. So if 3% of your monthly basic income is less than 300, so you still have to pay 300. And then if the 3% of your basic pay is more than 1,800, the maximum that you have to pay is only 1,800. Okay, so that would be the range for 2020. And then supposedly they have a scheduled increase this year, 2021, but this has already been suspended. So we'll see when they are going to implement the increase. So it's supposed to be 3.5%, again, to be shared equally by the employee and the employer. So minimum amount 350, maximum amount is 2,450. Okay, and then supposedly there's also what they call this, is scheduled increase. It's like 0.5% every year until 2024, until it reach 5%. Okay, so I have in 2022, it's going to be 4%, 2023 4.5%, and then 2024 onwards it's going to be 5%. Okay, and then the second video would be about the financial statement. So we'll have the quarterly FS as of September 2020, audited FS 2019, that's the latest available, and then we have their annual report for 2018. Okay, so we have here the website of PhilHealth, philhealth.gov.ph. Okay, and then they have their information about them, their organization, the agency, and then we have the top for members, their partners, online services, and then the downloads. All right, and then they also have their home, contacts, a site map, probably for their offices, disclaimer, privacy notice. Okay, so and then down here they have members, information that would prove important or significant or relevant to members, and then here we have the sections about the benefits. We'll be discussing this later on. And then also partners, mostly the hospitals or clinics, or what they call this, medical institutions. And then they have the online services, registration if you want to be a member, premium payment, and then reporting and locating their offices. Okay, and then we have the law. Okay, basically the videos mostly cover the laws or the basis for the existence of these government agencies, okay, for us to better understand why they are here and what's the importance of why we should have them and why we should continue to support. Anyway, it's mandatory provision provided by law. So essentially there's nothing we can do, but the willingness to continue to contribute should be there. As we are giving, might as well do it willingly. And in any case, given the controversies that they've faced in recent times, especially last year, because of the pandemic. There are certain issues that have cropped up. I'm not sure, probably certain programs that were handled or managed or implemented improperly or with some shortcomings, and then of course there are those projects that are questionable and unsupported by evidences, something like that. We will have a separate video on that, on the controversies that this institution, PhilHealth, has faced over the years, and in particular that 15 billion peso issue that they had, right? So we'll begin with RA 9241. This is the act constituting a national health insurance program for all Filipinos and establishing the Philippine Health Insurance Corporation for the purpose. Okay, what's good about PhilHealth? Okay, let's tackle that first. Okay, PhilHealth, we have the so-called Universal Healthcare Act, in which all Filipinos are supposed to be members of the PhilHealth, not only the paying members. So we have the paying members, those who are working, who are earning money. So they are, in a way, required or mandated to provide contributions or to pay the monthly premiums to the institution. Okay. And then on the other hand, we have these non-paying members. The people who are included here are, senior citizens who are no longer working. We have the indigents. We have the poorest of the poor, or the poor, or those people that are under certain programs through the DSWD. We have the 4Ps, and then what do you call this? The groups that are under those programs. So they are also members of PhilHealth, okay, because of those benefits that are provided to them through that Universal Healthcare Act. Okay, so in a sense, it's a good thing because even those fellow Filipinos that are in need, who don't have the financial capacity to provide for their medical needs, in case of emergencies, so they are not in any way, what do you call this, napapabayaan, neglected, okay, and as this certain assistance, medical assistance from PhilHealth are being given to them, all right, as members, being members of the agency as well. Okay, so even if they're not paying, given that they are Filipinos, they are registered members, so they could avail the benefits that are provided by PhilHealth. Okay, and in that sense, when you think about it, it's some sort of, what do you call that, redistribution of wealth. You have your Filipinos who are earnings, especially the wealthy, although there's a limit to the maximum premium that they have to pay. So in any case, and then of course we also have different generations, from 20 years old to 60 years old, and then of course, even if you're more than 60 years old, even if you're retired, you remain a member of PhilHealth and you can still claim the benefits provided by the institution. Okay, so you have, and then of course, you're a member. And then you have dependents. Sometimes, if your dependents get hospitalized, your children, so they can also avail of the medical benefits, okay, or all the benefits that can be provided to you by PhilHealth. So in a sense, it's really for everyone. Okay, it's really for all Filipinos. Okay, but since this is an insurance, so there are those factors, the fact that not everyone will get sick, and then of course the assumption is that the younger generation are not yet exposed to health risk, and then of course we have the assumption that the older generation are more prone to having illnesses, more prone to being diagnosed with certain sickness or just that sort of thing. Okay, and then in a way, we have this younger generation, or sometimes even the older generation, din naman. So, in a sense, okay, So we have this pool of members, and then we have certain people who are not availing the benefits because thankfully they are healthy. Okay, and then we have this other group of people who unfortunately became sick, confined to the hospital, diagnosed with health problems. So they are the ones availing of the benefits. Okay, so some sort of redistribution. Okay, so you have your people here, although paying, they are not availing of this benefits, but it's a good thing. Okay, it's a good thing because they're healthy. And then you have your group of people here who are, they are only paying minimum amount monthly. The minimum is 300, right? And then that's, if you're an employee, that's shared equally by the employee and the employer. Okay, so essentially that's 150 a month minimum. Okay, so if you're only contributing 150 a month, right? So that's how much in a year? 1,800 per year. Okay, and then let's say 10 years, so that's 18,000. Okay, and then you get hospitalized one time, and then let's say the bill comes up to 20,000. So in a sense, you can say na hindi ka naman lugi. Okay, once you're able to avail of the benefits as a member, hindi ka talaga lugi. Okay, because the benefits, the payments that are being paid out by PhilHealth for your medication, for your hospital bills, is normally way above and beyond the contributions that you've made during your, before you were hospitalized or diagnosed with an illness. So it's really a good thing. And later on, when we start discussing insurance companies in general, we will be looking into how do insurance companies survive in that with that scenario. Is it really these people who are paying but are not availing of the benefits, are they really more than the people who are availing of the benefits, that are in a way exhausting the resources of an insurance organization or an insurance agency? Okay, so we'll be looking into that for us to better understand. But in a way, I do believe that insurance companies, if you can avail, or if you would be claiming the benefit against an insurance company, then you are really, it's a protection for yourself, for your dependents. So it's a good thing. But if not, then we should not feel as if we should not feel as if we're cheated, or we should not feel that it's a waste of our money that we contributed and yet we're not, we haven't availed any service yet or any benefit yet. We shouldn't feel that way. Okay, because essentially when the time comes, we'll get older as well. Our body would get weaker, and we'll experience certain illnesses then when we grow older. Okay, so we shouldn't be questioning much about the rationality of the contributions and the benefits. What we do want to question, however, is the management of the funds. It's possible because recent controversies. It's possible that payments have been made, money has been disbursed, and yet these are not properly used for the benefits of the members. In reality, where's the 15 billion? That's the first question that we'll be having in the discussion of the controversies. Okay, anyway, let's continue on with this Republic Act 7875. The short title of this is National Health Insurance of 1995, Declaration of Principles and Policies. Constitution of the Philippines declares that the state shall adopt an integrated and comprehensive approach to health development, which shall endeavor to make essential goods, health, and other social services available to all people at affordable cost. Priority of the needs of the underprivileged, sick, elderly, disabled, women, and children shall be recognized. Likewise, it shall be the policy of the state to provide free medical care to paupers. Okay. In pursuit of a national health insurance program, this act shall adopt the following guiding principles. So we have allocation of national resources for health. The program shall underscore the importance for government to give priority to health as a strategy for bringing about faster economic development and improving quality of life. Universality, the program shall provide all citizens with a mechanism to gain financial access to health services in combination with other government health programs. Sometimes LGUs, they do provide their own, clinics, free medical programs. The National Health Insurance Program shall give the highest priority to achieving coverage of the entire population with at least a basic minimum package of health insurance benefits. Okay? Normally, later we'll see, depending on the type of sickness, the benefit, they do put a limit on how much you can claim for a particular type of illness or a particular type of procedure that you have to go through. They do put limits, okay? Equity, the program shall provide for uniform basic benefits. Access to care must be a function of a person's health needs rather than his ability to pay. Yes, sir. Responsiveness, the program shall adequately meet the needs for personal health services at various stages of a member's life. Okay. Social solidarity, the program shall be guided by community spirit. It must enhance risk sharing among income groups, age groups, and and persons of this differing health status and residing in different geographic areas. So in a way, if you're younger and healthy, the contributions that you're giving now are mostly going to the older generations who are, experiencing health issues. But by the time you get older, it would be the younger generation that would essentially be supporting you when the time comes. So, let's look at it in a way that you are helping others as well. While you are not claiming benefits at the current year or the current period, you have to look at it as if you're helping and supporting others. Okay. Effectiveness, the program shall balance economical use of resources with quality of care. Innovation, the program shall adapt to changes in medical technology, health service organizations, healthcare provider payment systems, scopes of professional practice, and other trends in the health sector. It must be cognizant of the appropriate roles and respective strengths of the public and private sectors in healthcare, including people's organizations and community-based healthcare organizations. So over the years, from the very beginning that PhilHealth was established, they do add, like new types of illnesses which they would, provide benefits for. And then over the years, there's now a long list of diagnoses that you can claim benefits from PhilHealth. And then also over the years, they did increase the limits or the benefits that you can claim for certain illnesses. Okay. And then I believe they also included the surgery cost for certain conditions. Okay. But again, there are limits, and over the years, depending on the changes that are happening in the medical field and of course the needs of the members, so they also respond to that. Devolution, the program shall be implemented in consultation with local government units subject to the overall policy direction set by the national government. Okay. The program shall provide effective stewardship, funds management, and maintenance of reserves. Yes, because again, funds are contributed by the members, the paying members. Okay. Informed choice, the program shall encourage members to choose from among accredited healthcare providers. The corporation's local offices shall objectively appraise of its members of the full range of providers involved in the program and of the services and privileges to which they are entitled as members. This explanation, which the members may use as a guide in selecting the appropriate and most suitable provider, shall be given in clear and simple Filipino and in the local languages that is comprehensible to the member. Healthcare providers. Okay. So I think they also, taken into consideration, the different locations, okay? Not every municipality has a clinic, not every municipality has a hospital that could cater to, every sickness that could be experienced by the localities or by the public. So in any case, of course, the membership, the availment of the services could be done anywhere actually. But it's like getting a choice on where you want to be confined when you get sick. Okay? And as for the others, they also have separate programs for the 4Ps, for the indigents, for the senior citizens, lifetime members. Okay? They have separate programs for that. Maximum community participation. The program shall build on existing community initiatives for its organization and human resource requirements. Compulsory coverage. All citizens of the Philippines shall be required to enroll in the National Health Insurance Program in order to avoid adverse selection and social inequity. Okay, so everyone can actually avail of the benefits provided by PhilHealth. Cost sharing. The program shall continuously evaluate its cost sharing schedule to ensure that costs burned by the members are fair and equitable, and that the charges by healthcare providers are reasonable. Okay, so because there are certain limits on how much the PhilHealth can provide as medical assistance to the members. So in excess of that, so let's say a person has been confined to a hospital, has been diagnosed, and then his bill came up to 50,000. But given the current regulations by PhilHealth, let's say what they can only shoulder is around 30,000. Okay, so PhilHealth will be paying or will be shouldering the 30,000, and then the remainder, the 20,000, would be shouldered by the member from his private or from his personal funds, right? So it's not the benefits is not unlimited. Like how much would be incurred as bills from the hospital, it's not going to be fully paid unless it's within the limits provided by PhilHealth. Okay. Professional responsibility of healthcare providers. The program shall assure that all participating healthcare providers, hospitals, they are being accredited, are responsible and accountable in all their dealings with the corporation and its members. Public health services. The government shall be responsible for providing public health services for all groups such as women, children, indigenous people, displaced communities, communities in environmentally endangered areas, while the program shall focus on the provision of personal health services. Preventive and promotive public health services are essential for reducing the need and spending for personal health services. Okay? Yes, so it's important as well that they do provide continuous health services to their as some sort of preventive and educational, so that the members would be able to take better care of their health of themselves. Okay, so that in a way it would help decrease the possibility of being diagnosed with illnesses later on. Okay, so the people should also be properly educated on how to take care of their health. Okay. Quality of services. The program shall promote the improvement in the quality of health services provided through the institutionalization of programs of quality assurance at all levels of the health service delivery system. The satisfaction of the community as well as individual beneficiaries shall be a determinant of the quality of service delivered. Okay. If I'm not mistaken, before they are very strict with the documents, that sometimes it's difficult for members to avail of the benefits. But I think over the years they've addressed that. They've made it easier for the members to submit documents, the documentary requirements for them to be able to, deduct PhilHealth benefits from their hospital bills. Cost containment. Where is it? The program shall incorporate features of cost containment in its design and operations and provide a viable means of helping the people pay for healthcare services. Care for the indigent. The government shall be responsible for providing a basic package of needed personal health services to indigents through premium subsidy. Okay, so in a way, the government, they're paying a certain amount to PhilHealth which is what we call the premium subsidy, which the institution can use for provision of health services to the indigents, okay, or through direct service provision until such time that the program is fully implemented, okay. So it's not essentially just, the private sector government employees that are contributing to the fund. Even the government, from the fund of the government, contributes to the fund, which in a way would help provide the services to the non-paying members. General objectives. This act seeks to provide all citizens of the Philippines with a mechanism to gain financial access to health services, create a national health insurance program, hereinafter referred to as a program, to serve as the means to help the people pay for healthcare services. Prioritize and accelerate the provision of health services to all Filipinos, especially that segment of the population who cannot afford such services. Establish the Philippine Health Insurance Corporation, hereinafter referred to as the corporation that will administer the program at central and local levels. Definition of terms, we have the beneficiary, benefit package, capitation, payment mechanism, fixed rate, whether per person, family, household, or group, is negotiated with a healthcare provider who shall be responsible for delivering or arranging for the delivery of healthcare services required by the covered person under the conditions of a healthcare provider contract. Okay. Contribution, coverage, dependent, legitimate spouse who is not a member, unmarried and unemployed, legitimate, legitimated, illegitimate, acknowledged children, legally adopted, stepchildren below 21 years of age, children who are 21 or above but suffering from disability, either physical or mental, renders them totally dependent on the member for support, parents who are 60 years or above whose monthly income is below an amount to be determined by the corporation in accordance with the guiding principles. Diagnostic procedure, any procedure to identify a disease or condition through analysis and examination. Emergency, unforeseen combination of circumstances which calls for immediate action to preserve the life of a person or to preserve the sight of one or both eyes, hearing of one or both ears, one or two limbs at or above ankle or wrist. Employee, any person who performs services for an employer. Okay. Employer, enrollment, fee for service, a reasonable and equitable healthcare payment under which physicians and other healthcare providers receive a payment that does not exceed their billed charge for each unit of service provided. And then we have the global budget, based on predetermined and fixed budget. GSIS. Healthcare provider refers to healthcare institution, hospitals, clinics, duly licensed and accredited. Healthcare professional, doctors. Health maintenance organizations, community-based healthcare organizations. Okay, we have the health insurance identification card, indigent, inpatient education package, member, means test, okay, Medicare, health insurance program currently being implemented by the Philippine Medical Care Commission. Program 1, which covers members of SSS and GSIS, including the dependents. Program 2, intended for those not covered under Program 1. Okay. And the National Health Insurance Program, compulsory health insurance program of the government. Okay. And then we have pensioner, personal health services, Philippine Medical Care Commission, Philippine National Drug Formulary, portability, prescription drug, public health services, quality assurance, residents, retirees, self-employed, social security system, treasury procedure. Okay, so those are the terms being used in this document. Okay, so we've read healthcare providers, right? So we have the PhilHealth, which is a publicly available health insurance. And then we have private health insurance companies, okay? Some people, they do acquire those health insurance as well on top of PhilHealth, because, PhilHealth, they do have a limit on how much they would be covering for the medical fees, depending on what they have on, their regulations. And then if you have a private insurance, from a private company, Okay, they could also provide, with additional limit, or they do provide limits that are higher than PhilHealth, because essentially your premiums that could be higher than what you pay PhilHealth as well. So in a way, if you can use PhilHealth, and then on top of that, if there's excess bill from the hospital that you have to pay, you can try and apply your private health insurance and then see how much would be covered. And then sometimes essentially there would be nothing left on your bill sometimes, okay, but other instances, of course, there would still be some leftover bill that you have to pay, okay. But getting private insurance would also be good if you can afford it, of course, which would also help you in case of severe cases of illnesses or diagnosis that would require that would probably result to higher hospital billings, okay. So that's it. But then normally itong mga private health insurance companies na to, they would require that you apply first the benefits that you will get from PhilHealth before they would cover the remaining. Okay, so if you do not apply your PhilHealth, let's say the limit of PhilHealth is 5,000 and then your bill is 15,000, the private health insurance is should cover the excess of 5,000 what's being provided by PhilHealth. So let's say kinover nitong private health insurance yung 10,000, from 5,000 to 15,000. But then yung 5,000, if you do not apply your PhilHealth membership, you would have to pay for that. Okay, so it's not what do you call this? It's not good enough for you to have a private insurance alone. You still have to ensure that you have the PhilHealth, because these private companies would first apply what is being provided by PhilHealth before they cover what remains, if any. Okay, so there's that type of scenario. Okay, National Health Insurance Program establishment and purpose. Okay, ensure affordable, acceptable, available, and accessible healthcare services for all citizens of the Philippines. Okay. Shall serve as the means for the healthy to help pay for the care of the sick and for those who can afford medical care, to subsidize those who cannot. Okay. Initially consists of programs 1 and 2 or Medicare, and be expanded progressively to constitute one universal health insurance program for the entire population. Program shall include sustainable system of funds constitution, collection, management, and disbursement for financing the availment of a basic minimum package and other supplementary packages of health insurance benefits. Shall be limited to paying for the utilization of health services by covered beneficiaries or to purchasing health services in behalf of such beneficiaries. Shall be prohibited from providing health care directly, from buying and dispensing drugs and pharmaceuticals, from employing physicians and other professionals for the purpose of directly rendering care, and from owning or investing in healthcare facilities. Okay, so they're not allowed to do that, to build their own hospitals and hire their own doctors, nurses, and to provide, the drugs, the prescriptions. Okay, they're not allowed. So essentially, they would have to focus solely on, as the insurance company, and work closely with the accredited healthcare providers, okay, the hospitals or medical institutions. Then we have coverage. All citizens of the Philippines shall be covered with the principle in accordance with the principles of universality, compulsory coverage. Okay. Gradual and phased in over a period of not more than 15 years. So this is 1995. It's already 2021. So currently, all citizens of the Philippines are members of the agency already. Enrollment. So we have that. You have to enroll, visit a PhilHealth office, or maybe do an online registration. Ensure that you get your PhilHealth number, and if you can, get an ID as well. Okay. All persons currently eligible for benefits under Medicare Program 1, SSS and GSIS members, retirees, pensioners, and their dependents shall immediately and automatically be made members of the National Health Insurance Program. All persons eligible for benefits through health insurance plans established by local governments as part of Program 2 of Medicare or in accordance with the provisions of this Act, including indigents, shall be enrolled in the program. All persons eligible for benefits as members of local health insurance plans established by the corporation in accordance with the implementing rules and regulations of this Act. Okay. Enrollment of persons who have no current health insurance coverage shall be given priority. All persons eligible for benefits as members of other government-initiated health insurance programs, BSWD, community-based healthcare organizations, cooperatives, or private non-profit health insurance plans shall be enrolled in the program upon accreditation by the corporation, which shall devise and provide incentives to ensure that such accredited organizations will benefit from their participation in the program. Alright. All indigents not enrolled in the program shall have priority in the use and availment of services and facilities of government hospitals, healthcare personnel, and other health organizations, provided such government healthcare providers shall ensure that said indigents shall subsequently be enrolled in the program. Okay, so for these people, even if they are not yet enrolled, if they do need to avail the services, they would be given the service, and then during that or subsequently, they have to be enrolled in the program. Health insurance ID card, change of residence, benefit package. Okay, you have your inpatient hospital care, room and board, services of healthcare professionals, diagnostic, laboratory, other medical examination services, use of surgical or medical equipment and facilities, prescription drugs and biologicals subject to limitations, and inpatient education packages, outpatient care, services of healthcare professionals, diagnostic, laboratory, and other medical examination service, personal preventive services, prescription drugs and biologicals subject to limitations, emergency and transfer services. Then you also have such other healthcare services that the corporation shall determine to be appropriate and cost-effective. Okay, over the years, they added different types of diagnosis, different types of medical needs. Okay, costs of providing said package. Sorry. So you have this. Excluded personal health services, non-prescription drugs and devices, outpatient psychotherapy and counseling for mental disorders, drug and alcohol abuse or dependency treatment not covered, cosmetic surgery, home and rehabilitation services, optometric services, normal obstetrical delivery, cost-ineffective procedures which shall be defined by the corporation. Entitlement to benefit, so you have at least 3 months paid within 6 months prior to the first day of his availment. Okay. The following need that pay the monthly contributions, of course, the retirees, pensioners, members who reach the age of retirement and have paid at least 120 monthly contributions, and enrolled indigents. Portability of benefits across offices anywhere you would like to avail of the services. And then we have the PhilHealth Insurance Corporation. Creation and nature in accordance with the corporation law. Exemptions from taxes and duties. Powers and functions. So we have this, what they are supposed to do for them to implement and provide the services that they are tasked to provide to the public. Okay. Quasi-judicial powers, board of directors, you have your composition, and then you have your appointment and tenure of the board of directors, meetings and quorums, allowances and per dimes, president of the corporation, appointment and tenure, duties and functions, qualifications, salary, provision, we have health finance, policy, research. Okay, and then we have the local health insurance office establishment. As much as possible, they're providing local offices in provinces, cities, municipalities, functions. Okay, they have a lot, so you might want to read this in your own sweet time. National Health Insurance Fund creation. And then contribution of the members, current balances, appropriations, allocations, donations and grants and aids, accruals, components of the fund, basic benefit fund, and then you have your supplementary benefit fund, financial management, reserve fund, and then we have the financing, mainly from the contributions of the members. And then we have payment for indigent contributions, subsidized partially by the local government, okay, and then the national government. You have your healthcare providers, pre-choice of health facility, medical or dental practitioner, authority to grant accreditation, accreditation eligibility, and then we have minimum requirements for accreditation. These are for the healthcare providers. Alright, and then you have your provider payment mechanisms, fee-for-service payments and payment in general, capitation payments, quality assurance, safeguards against over or under utilization, grievance and appeal, grievance system, grounds for grievances, grievance and appeal procedures, grievance and appeal review, hearing procedures, have that, penalties, penal provisions, for the employer, for the corporation, employee of the corporation, appropriations, initial appropriation, you have your subsequent, and then additional appropriations, transitory provisions, appointment of board members, IRR, promulgation, merger. I think originally they have the Philippine Medical Care Commission, and then after the creation of Philippine Health Insurance Commission, this was abolished. And then you have your transfer of health insurance funds of the SSS and GSIS, transfer of Medicare functions of the SSS and GSIS. Okay. And then you have your miscellaneous provisions, although in a way SSS still provides sickness benefits, right? Miscellaneous provisions, oversight provision, information campaign, separability clause, repeating clause. Alright, so you have all the rest of it. Okay, next we have, what's this? I think this is an amendment, an act amending Republic Act number 7875, otherwise known as the National Health Insurance Act of 1995, as amended and for other purposes. I'm not sure if this is a lot. What are the amendments? Declaration of policies to adopt an integrated and comprehensive approach to health development, which shall endeavor to make essential goods, health, and other social services available to all the people at affordable cost, and to provide free medical care to paupers. Towards this end, the state shall provide comprehensive healthcare services to all Filipinos through a socialized health insurance system that will prioritize the healthcare needs of the underprivileged, sick, elderly, persons with disabilities, women, and children, and provide free healthcare services to indigents. Okay. Where are the amendments? Definition of terms. The dependent was amended. Parents who are 60 years old or above whose monthly income is below an amount to be determined by the corporation. Okay. Parents with permanent disability that render them totally dependent on the member for subsistence. Fee for service, a fee predetermined by the corporation for each service delivered by healthcare provider based on the bill. Okay. Payment system shall be based on the pre-negotiated schedule promulgated by the corporation. Indigent, who has no visible means of income, whose income is insufficient for the subsistence of his family, as identified by the SWD based on specific criteria set for this purpose. Member whose premiums have been regularly paid, who may be a paying member, sponsored member, or a lifetime member. Retiree has reached the age of retirement. Okay. Abandoned children, case-based payment, health technology assessment, informal sector, other self-earning individuals. Okay. Outpatient services such as diagnostic, consultation, examination, treatment, surgery, and rehabilitation on an outpatient basis. Professional practitioners, doctors, lawyers, CPAs, and other practitioners required to pass government licensure examinations in order to practice their professions. Traditional and alternative health care, the application of traditional knowledge, skills, and practice of alternative health care. or healing methods, which include reflexology, acupuncture, massage, acupressure, chiropractics, nutritional therapy, and other similar methods in accordance with accreditation guidelines by the corporation and the FDA. Lifetime member, members in the formal economy, members in informal, migrant workers, sponsored member. Okay, so these are the additional terms as amended. And then you have your mandatory coverage, enrollment, members in formal, informal, indigent, sponsored, and lifetime members. So these are the categories of members. Amended, meaning ng health insurance identification card and ID number. The absence of the ID card shall not prejudice the right of any member to avail of the benefits or medical services under the National Health Insurance Program. So although you don't have your ID to present, as long as you're a member, but you can just, provide your ID number. The ID shall be recognized as a valid government identification and shall be presented and honored in transactions requiring the verification of a person's identity. Section 7, benefit package in inpatient. Are there new ones? Outpatient, okay. Emergency, such other healthcare services. Excluded personal health services, not covered. Entitlement to benefits. Powers and functions of the corporation. So we have are these additionals or amendments. Quasi-judicial powers, board of directors, president of the corporation, health finance policy research, creation of National Health Insurance Fund, contribution, other appropriations, subsequent appropriations, donations, all approvals. Financial management, reserve fund. So they have this. Excuse me. Okay, so if you're, interested to know more about the details of the law, the amendments, so you can check these out. So normally, as a person, as a member of the public, as a member of PhilHealth, normally you only get interested to know about the details when you are, on the verge of availing the services. When you get sick, when you want to check with hospitals, or like, are these covered with PhilHealth? Then you go on the internet or on their website to check whether a particular transaction with a hospital will be covered by the PhilHealth. Alright. Okay, violations of employer, oversight provision. Alright. And then we have the IRR of the Act. Normally, the components are the same as the RA. Alright, so we have the objective, nature, and scope of functions provided as well in the RA. You have your issuance of ID card, replacement, requirements for registration, alright, emancipated individual or single parent, remittance of premium contribution, effectivity, and then I'm just going to go over the content, the table of contents, alright. Registration of employers, requirements for registration of employers, employer data amendment, obligations of the employer, rates of premium contributions, mandatory appropriations, payment of premium contributions, remittance, premium payment of government and private sectors with multiple employment, obligations of employer of household help or kasambahays, premium payment, and then you have your in the informal sector, payment of premium, cost sharing, cessation from formal or coverage as indigent, sponsored member or as migrant workers, retroactive payment, enrollment of citizens of other countries, specific provisions concerning indigents, identification and enrollment, payment of premium, women as primary members, data sharing on the list of indigents and their dependents, specific provisions concerning sponsored members, payment of contributions, concerning lifetime members, required number of monthly contributions to qualify, lifetime member with current source of income, requisite for issuance or renewal of license, permits for what are these? Okay. Benefit entitlement. So rule 1, you have your benefits, objective functions, benefit package, excluded personal health services, entitlement to benefits, continuation of entitlement to benefits in case of death of member, benefits of members and their dependents confined abroad. Payments of claims. So you have your basically what they call this guidelines on the implementation of the law with regards to the hospitals. What are the obligation of the hospitals? What kind of reports do they have to prepare for them to bill the PhilHealth for or on behalf of the patient? Things like that. So there, the guidelines are provided in the IRR. And then quality assurance and accreditation of the hospitals, for them to provide services to the members and for them to be able to properly claim the benefits on behalf of the members. So normally, members can go only on to accredited medical institutions. Okay, if a hospital is not accredited, so normally they cannot deduct what do you call this? Real time the benefits that the member is entitled to with regards to PhilHealth benefits. Okay. So normally, although most of the hospitals naman are already accredited, okay, you rarely see hospitals that are not accredited yet, or clinics or laboratories. Okay, so you have that grounds for denial, non-restatement, performance monitoring, outcomes assessment, mechanism for feedback, health technology assessment, policy formulation and review, creation of the funds, quasi-judicial powers of the board, what they're supposed to do, what they're meant to do, rules of procedure on administrative cases against healthcare providers and members. So if there are complaints, grounds, venue, and parties. Okay, so who may file, where to file, grounds for complaint against a member or a healthcare provider. Okay, sometimes fraud, maybe those can be investigated just to ensure that what needs to be paid are paid and what shouldn't be paid should not be paid. Alright. So you have the guidelines with that on that regard as well. Appeal, review of appeal, decision process, entry of judgment, execution of decision, writ of execution, appeal, offenses of healthcare institutions, filing of claims for non-admitted or non-treated patients. These are fraudulent activities that in a way deplete the funds by the PhilHealth. So these are fraudulent and should not be done by the healthcare provider. So it's an offense, and there are corresponding penalties. They could be sued or the claims could be recovered. Okay. Misrepresentation, breach of warranties, fraudulent acts, criminal liability, violations, scale of administrative penalties. There are a lot. They basically covered the different scenarios that could happen that could be detrimental to the position of PhilHealth. So it's good that they provided clearly the guidelines in the IRR. Alright, so there are a lot. If you're interested in any particular topic, so you can just go ahead and read the document, the IRR. Alright, and lastly, we have the benefits of PhilHealth: inpatient benefits, outpatient C benefits, and SDG related. I'm not very familiar with the benefits, but they do have a list, so hopefully we can see them. Okay. Normally what happens is, for example, if you're a member and then it's either you who gets hospitalized or your dependents. Okay, when you go to the hospital, of course, first thing that they ask is if you are a PhilHealth member, and then you're going to, fill out certain forms, and then you can directly ask the hospital staff on, how much would be covered by PhilHealth for the particular diagnosis that you have, or for the particular medical condition that you are going to the hospital for. Okay, so normally that's the easiest way you can know the kind of benefits that you can avail in your particular situation. But if you're interested to know all the types of benefits that they do provide, so I think they do have materials. At one point I did download a certain handbook of some sort wherein it was listed there all the benefits that can be availed. Okay, so I have these. Paid to the accredited healthcare institution through all case rates. Case rate amount shall be deducted by the HCI from the member's total bill, which shall include professional fees of attending physicians prior to discharge. Case rate amount is inclusive of hospital charges and professional fees of attending physician. Availment condition: member must have 6 months contribution preceding the 3 months qualifying contributions within the 12-month period prior to the day of confinement. Documents needed, so you can download here, or the hospital can provide them as well. We're available, or all accredited HCIs. You can check their list. Only admissible cases shall be reimbursed. Okay. For outpatient, so they have these day surgeries that include elective surgical procedures ranging from minor to major operations where patients are safely sent home within the same day for post-operative care. Okay, all case rate then. Radiotherapy, hemodialysis, case rate 2,600 per session, covers both inpatient and outpatient, so 90 days benefit limit. Must be availed of even a second case rate. Alright, other information. Outpatient blood transfusion, 3,641 or more units, includes drugs and medicines, x-ray, lab and others, operating room. Covers outpatient, 1 day of transfusion of any blood, regardless of the number of bloods, is equivalent to 1 session. 45 days benefit limit. Must be availed of a second case rate. Primary care benefit, corporation, indigent, sponsored, OFWs, organized groups were to avail. Disease conditions: asthma, acute gastroenteritis, upper respiratory tract infection, pneumonia, urinary tract infection. Benefit inclusions: preventive, so consultation, visual inspection, regular BP, breastfeeding, periodic clinical breast examinations, counseling for lifestyle modification, counseling for smoking cessation, body measurements, digital rectal examination. Then you have your diagnostic examinations: complete blood count, urinalysis, fecalysis, sputomicroscopy, fasting blood sugar, lipid profile, chest x-ray. Drugs and medicines: inhaled corticosteroids. Sorry, couldn't pronounce all of this. Short-acting beta-2 agonist inhalation solution, oral or systemic corticosteroids, oral rehydration salts, amoxicillin, macrolide, beta-lactams, second-generation cephalosporins, oral fluoride. These are the drugs and medicines. Anyway, how to avail? So go to the offices, visit the PCP provider where you are assigned or enlisted. Expanded primary care benefits, so they have this, where to avail. This is conditions, and then you have your life stage groups, essential services, depending on the age group. So you can avail of these services. Drugs and medicines listed. Notes: free only for the member or one of his or her dependent. Initial health screening and assessment. Initial essential services. Fixed full payment for that. Regular fee. How to avail. Okay, so these are the requirements. And then you have the Z benefits. What are Z benefits? Oh, this is bad. Acute lymphocytic leukemia, breast cancer, prostate cancer, end-stage renal disease, eligible for requiring kidney transplantation, 600,000. Coronary artery bypass, graft surgery, 550. Surgery for tetralogy of fallopian children, 320, surgery for ventricular septal. These are, severe cases, I'd say, that would be needing surgery or what do you call that? Extensive healthcare. Cervical cancer, Z-morph, expanded Z-morph, selected orthopedic implants, hip, partial hip, total hip, cemented, cementless, implants for hip fixation, implants for pertrocantary fracture, implants, femoral shock fracture. There's a lot, okay? Colon and rectum cancer, premature and small newborn, prevention and preterm delivery. So we have all this under Z benefits. Okay, children with impairments. Okay, and let's look at SDG related. What does this mean? Outpatient malaria package, HIV/AIDS package, outpatient anti-tuberculosis. Okay. Voluntary surgical contraception procedures, animal bite, rabies. Okay, so those are the SDG benefits, I guess. Alright, so that's it for this video. Second video will be having the financial statements, and then another video for the current controversies that the institution is facing. Alright, so that's it. Thanks and bye.